Welcome to this training from GATE, which looks at HIV community-led monitoring. This virtual training and accompanying guide aims to build the capacity of organisations and activists to act as watchdogs in the implementation of national HIV responses, and specifically monitoring the implementation and expenditure of HIV programming at national levels. The course aims to build knowledge and practical skills for trans, gender diverse and intersex organisations and activists to act as watchdogs. It shares examples and case studies of effective practice. It provides an overview of the key principles of HIV programmatic monitoring, and it provides guidance on what steps can be taken as actions when planning budgets and approaches for future work. And the format of the course is structured into a series of videos with a written supporting guide. There's a pre-training questionnaire. This is to assess your level of knowledge at the beginning of the course and help track your progress over time. Please complete this before starting the videos. There are 5 training videos covering key different areas. Each one is around 15 to 20 minutes long. Watch the videos in order. There will be 2 to 3 questions that come up in each video, and these are designed to help you review your learning and support you to apply the principles to your own work. You can answer these as you work through the videos or at your own pace. There is a separate worksheet which can be downloaded to support you to do this. There is a summary guide with case studies and links to further resources, which mirrors the structure of the 5 videos, and this acts as a summary of the main points which will be covered. Finally, there is a post-training questionnaire which will assess what you have learned during the course. Welcome to the first video in the course. This video will look at what is accountability and community-led monitoring. And this is the first of the 5 videos. The following videos will look at understanding the Global Fund and USAID programming cycle, monitoring and funding for community-led monitoring and accountability and community-led monitoring tools, and action planning, how to bring this into your work going forward. So the learning objectives for this first video are to introduce key concepts of accountability and community-led monitoring, to build knowledge of how this fits within Global Fund and USAID programming, and to challenge you to consider how these support advocacy. And this video is going to cover 5 different sections. The first, an overview of different types of accountability. Secondly, what types of skills are needed for accountability and watchdog roles. Third, what is community-led monitoring? Fourth, how community-led monitoring connects with HIV donor monitoring. And finally, how can we use accountability and community-led monitoring as an advocacy tool? So I'd like to start off with a prompt question to get you thinking. And please refer to the worksheet if you haven't already downloaded this. There's a space to respond to questions on that worksheet. So what are your health priorities as a transgender, diverse or intersex person? What gaps exist in accessing services or treatment that you've personally experienced or you've seen amongst community members? What is and isn't working and what needs to change? Take some time to think this through. You can add to this at your own pace if you'd like to respond further. Let's move into the content of this video and start with an overview of the different types of accountability and why it's important. Accountability is essentially a relationship or a social contract between the government or whoever the power holder is and the governed or citizens. And it's about identifying gaps between the commitments made by power holders and their actions, and holding them accountable for the gap between those commitments and actions. There are different types of accountability. You have vertical accountability, which is bottom up, where citizens use the power that they have to counter what the government's power or leaders, how government and leaders are using their power. And this can be through voting for a different party, for instance, or using public pressure through petitions or campaigns to shift policies, or trying to withdraw the mandate for a local MP, for instance. Horizontal accountability is more about the power relations between different bodies within the government. So that's the executive, the power to enforce the laws, the legal through Parliament, and the judicial, so through the legal courts, or those who have the power to interpret laws. Top-down accountability is where the government holds its own institutions to account on behalf of citizens, though citizens can still call out those powers if they see abuse or corruption through ombudsman bodies. And finally, social accountability is about changing mentalities, building relationships and developing capacities, as well as using the different technical tools for accountability. And this should be seen as a part of existing advocacy work. And there are lots of different models for accountability. This is a useful visualization from Accountability International, which sees accountability as a cycle or a cyclical process between transparency, dialogue, and action. A brief note on why community-led monitoring is different from monitoring and evaluation. Monitoring is the continuous oversight of ongoing activities. The Global Fund defines this as tracking key elements of a program or project, usually the inputs and outputs, through record keeping, or it can be through regular reporting and surveillance. And this certainly is a part of community-led monitoring. Evaluation is the systemic examination of outcomes, usually from a program again, against its stated objectives or goals. And this can be focused on health services, or it can be internal program data. And again, it can be part of community-led monitoring. Where community-led monitoring differs is that this usually has an advocacy aim, and the data collected is there to provide evidence for advocacy and aiming to make a change. And to define what is a watchdog role, I feel this is important before moving on to the rest of the content of this course. This can be described as a role which focuses on accountability. It's about assessing against commitments and using evidence again for advocacy, but it's seeking to improve feedback within implementation cycles and hold duty bearers or power holders to account. Now, in some contexts, this can be a politically charged term. It can be seen as confrontational, perhaps. So you may prefer to use other terms to describe accountability work, such as a critical friend or a community advocate, for instance. And building trust and developing the right kind of community-based monitoring models can be important in these contexts. Government can sometimes perceive watchdog roles as trying to embarrass or criticize them. And this can result in harassing monitors, people who are undertaking community-led monitoring work, and obstructing that work. So building this trust is important, and sometimes framing monitoring as a form of partnership can help government to become more open to this collaborative way of improving systems. To share a few examples of what community-led monitoring has achieved, here are 3 examples from the African context. So the Regional Community Treatment Observatory in West Africa, set up by ITPC, found that the rate of viral load suppression improved, this is for HIV, from 48 to 77% as a result of the community-led monitoring that they conducted. In Kenya, the community-led monitoring focused on collecting evidence on barriers to accessing health services, and this resulted in over 700 cases being referred for legal support. And in the DRC, TB medication stockouts were drastically reduced from 95 to 5%. So you can see here the potential for community-led monitoring to have very positive and concrete impacts and affect change as a result of the evidence collected. Now I'd like to move into what types of skills are needed for these accountability and watchdog roles. Key soft skills to build are building trust-based relationships, as previously mentioned earlier. This will help to reduce the uphill battle in making the powerful or the power holders accountable. Collaboration is also key for the best chance to generate positive change. Understanding the political context of the activities that you're monitoring and ensuring that you're targeting the right people is important, but offering solutions as much as identifying problems is a critical step in the community-led monitoring process. And doing this in a collaborative way with allies or key stakeholders can really improve the outcomes from community-led monitoring. There are also process skills involved in identifying goals, gathering and monitoring the data and being able to analyze it, strategizing and actually delivering the advocacy that you would like to see, and being able to, in an ongoing way, adapt and review the approaches that you're taking to make sure that they are as effective as they can be. So moving on to a definition of what is community-led monitoring, what do we mean by this term? So community-led monitoring is essentially a community empowerment and accountability process, and in this case for improved responses to HIV. It's led and implemented by community-led organisations of people from the communities affected, so transgender, diverse and intersex people. And communities identify and routinely collect and analyse that data, and the data is often qualitative and quantitative. And the people that collect that data are usually trained and sometimes paid members of communities. The data is meant to be owned by the community and used to inform targeted and local action. It often aims to include data from people in community settings who might not be accessing healthcare, and to document positive innovations and effective practices. And it can be used to reveal problems and co-create solutions at different levels, from very micro kind of facility level to community level and beyond. To make this more explicit, the essential principles from different sources, including the Global Fund, UNAIDS, define community-led monitoring as being led, owned and implemented and supported by communities. It focuses on what communities care about. It's independent of services or systems that are being monitored. It's focused on action accountability, so that's where the advocacy tie comes in. But not only by seeking big policy changes, it can be used to inform local changes. And all monitoring activities should feed into plans for change and be disseminated. It's routine and systematic. This helps to better track change over time, as well as it being sustained over time. So this helps to provide updated data. It's accountable to communities and the end users of services. It's based in community engagement and mobilization, so it's supported by training and capacity building so that skills are shared across communities. It's transparent, so providers can aid feedback by making data available. It's collaborative and it's adaptable, so it's able to address emerging issues and changes. The first step is to define what objectives you would like to use for your community-led monitoring. And a very useful tool is this toolkit developed by the Women for the Global Fund, and it describes 4 different models for this. But we're going to focus on the social audit objective. This is the most broad and comprehensive approach to community-led monitoring, and it incorporates a variety of different tools and processes, and it's also the most commonly used. There are different models of community-led monitoring. Many agree on the idea of a cycle of stages that continue to feed into one another, and some have more or less stages. And this one from ITPC has 4, and this continues in a cycle and begins with education. This is the first stage where communities are trained on the key issues at stake, or they're made aware of national treatment guidelines, for example, what they can be measuring against. This feeds into then the evidence stage of gathering the data. This could include a baseline assessment, data collection, data verification, and data analysis. And once the data has been analysed and key trends have been identified, then you would go into your engagement stage. So this is where you discuss findings with a wider group of stakeholders, and this could be with power holders, with decision makers, and it's focused on trying to create solutions together. And if this doesn't work, if the power holders don't want to listen, then you would move to the advocacy stage and your traditional advocacy activities where you're trying to change norms or standards or policies. And sometimes this can go back to engagement. There can be a continual dialogue. And if the advocacy is not successful, or you see that there is further change that is needed, it can go back to the beginning stage and start off a new cycle of community-led monitoring. Similarly, this is a 5-stage model from HealthGap, which adds in the stage of monitoring after advocacy and before resuming data collection, as well as dissemination with the engagement stage. This is a cycle from IANASO, the Regional Platform for Communication and Coordination of HIV, TB and Malaria for Anglophone Africa. And this breaks down the different stages in even more detail. So after influencing and advocacy, for instance, you can see there's a follow-up and closure stage before monitoring. There are common elements that can be drawn from all of these models and broadly brought into 5 stages: capacity building and planning, leading into data collection and the analysis, then the dissemination of those findings and engagement with the power holders and duty bearers. If this is not successful, it leads to advocacy and back again into engagement and back into advocacy, and then into further monitoring to measure the success or the impact of that advocacy if the change has been reached. If further information or data is needed, it can go back into the capacity building and planning stage for another cycle. Now, a test question to review your learning. Please refer to your worksheet to record your answer there. What are the key principles around community-led monitoring? Any of these answers would have been correct. Next, let's look at how community-led monitoring connects with HIV donor monitoring. PEPFAR, UNAIDS and the Global Fund all have their own definitions and vision for integrating community-led monitoring into their ongoing monitoring work. The Global Fund frames it as community-based monitoring, but includes all the same essential elements as we've already defined them, focusing on the ability to monitor general issues such as community services, specific diseases such as HIV, or specifics within the program, such as the quality of services for transgender diverse or intersex people. The Global Fund sees community-led monitoring as an opportunity to improve the quality of their work, and because it helps collect, assess and triangulate data for their program oversight, they really value it. The Global Fund's current strategy, which runs until this year, explicitly focuses on community-led monitoring under the area of community system strengthening. It's one of 4 priority actions under this area. And its performance framework has specific indicators as well. It measures the percentage of community-based monitoring reports presented to relevant oversight mechanisms. And here's an example from the Ugandan COVID-19 Rapid Response Mechanism funding request as a template for how to resource community-led monitoring. So you can see here resourcing for data collectors, for technical support in cleaning and analysing the data, and money to support the engagement and dissemination stage, so talking to those different power holders and giving feedback through meetings and kind of sharing of the data. Now, the approach supported by UNAIDS is again very similar. It focuses on, their definition focuses on how community-led monitoring uses a structured platform and trained PM monitors to collect the data. And they explicitly talk about this in terms of it being a watchdog role for the national HIV response. And the definition from PEPFAR is again very similar, focusing on it being implemented by community-based and civil society groups with the aim to translate data into action and change. And PEPFAR has gone a stage further in ensuring that community-led monitoring is a core part of its approach by issuing guidance that the 2021 country and regional operational plans, so these are the outline plans for the whole approach of PEPFAR in each country or region, that these should include community-led monitoring within these. And they see it as being helpful to improve and diagnose issues and pinpoint problems and challenges, and importantly, as a collaboration between communities, the PEPFAR team, and health facilities. A quick test question to review what we've learned so far. Please refer to your worksheet to record your answer there. Which global HIV institutions actively integrate and support community-led monitoring in their program approaches? These are the answers that you could have had. Now on to the final section of this video. How can we use accountability and community-led monitoring as an advocacy tool? Well, let's start with why use community-led monitoring in the first place. It can be a powerful tool when it's focused on change as its goal, and data-driven advocacy can be very effective. Taking the case study of the prevention shadow reports created by Frontline AIDS, these were used in advocacy towards the Global Prevention Coalition and have shown how effective this can be. So these were focused on high HIV burden countries and were comparing action and commitments made in the 10-point plan from the Global HIV Prevention Coalition. They were developed in partnership with community organisations in several countries, and they focused on areas neglected by the official HIV reporting, so qualitative data around criminalisation and stigma, and where there were gaps in the data, particularly around trans, gender diverse and intersex people. And the data was used very effectively for advocacy. It was an annual exercise, so there was comparison over time, year on year. And in 2020, it focused on analysing against the key 10-point plan of the Global Prevention Coalition and where gaps were still existing against the goals of the 2020 roadmap. More broadly, community-led monitoring supports comparable data over time, so it can be used to track changes. The data can be used to inform advocacy, as we've discussed, and it allows for that targeted response based on what the community actually sees as important, compared to what a donor or a program implementer might see as important. And it can collect qualitative information, compared to quantitative information, which is usually what donors or organisations like the Global Fund and USAID tend to focus on. So it can be more nuanced, more subtle, and it can be used to tell stories about the implications of actions, which can be more personal and persuasive for decision makers. It can also be used to highlight data gaps, and particularly there is often a lack of data recorded on trans, gender diverse and intersex people. For instance, the National Global Fund response is not required to disaggregate or use indicators for trans people, and it doesn't track at all intersex or gender diverse people more broadly. When we are not seen as a key population, we are excluded in monitoring, and so we can counter this by tracking data or advocating for the inclusion of trans, gender diverse and intersex people as populations. So that's the end of the first video, and the next video, which will be coming up after this, will be focusing on understanding the Global Fund and the USAID programming cycle.